Hello, and welcome back. Today, I am going to talk about acne, which is a very common skin condition. Most of us get acne spots at some point in our lives. Although acne goes away over time, it can continue into adult life, and some people can have it over the age of 35. Please don't forget to share and like our videos. We are hoping these videos can also help other people. Acne is a common skin condition, and it can happen anywhere on the skin. The most common sites include face and neck, shoulders, back and chest. Acne can present in various ways. Blackheads appear black due to the presence of hair follicle and a small black or yellow bumps that occur on the skin. These are not filled with dirt or pus. Whiteheads look like blackheads and could be firmer. If these are squeezed, nothing usually comes out. Papules are small red bumps that can be sore and tender. Pustules are similar to papules with a white tip in the center due to the presence of pus. Nodules are large hard lumps that occur under the skin and can be painful. Cysts are the most severe type of acne spots. These may appear similar to boils and are large pus-filled lumps. Cystic acne can lead to permanent scarring. The exact cause of acne is not fully known, and it is commonly linked to hormonal changes during puberty, positive family history, and hormonal changes during menstrual cycle or pregnancy. The hormonal changes can produce larger amounts of oil in the skin called sebum next to hair follicles, and this can lead to some bacteria in the skin to cause inflammation and pus. The hormones also thicken the inner lining of the hair follicles, leading to blockage of the skin pores. This type of blockage cannot be removed by cleaning the skin. Acne is most common in girls from the ages of 14 to 17, and in boys from the ages of 16 to 19. Acne often goes away when people reach their mid-20s. In some cases, acne can continue into adult life, and a small proportion of people can have acne over the age of 35. There is no conclusive evidence to suggest that acne is caused by bad hygiene, diet, or sexual activity. However, it is best to avoid any possible triggers or aggravating factors if known to play a role in causing acne. Frequent face washing can irritate the skin further, so it should be avoided. Lukewarm water rather than very hot or cold water should be used. It is best to use non-comedogenic facial products that are water-based rather than oil-based comedogenic products. Acne spots or blackheads should not be squeezed or popped, as this can cause scarring and infection. There are various acne treatments that can be used to treat acne. These include benzoyl peroxide, Clearasil, adapalene or differin, Duac gel and Zinarete. Tretinoin, clindamycin gel or dapsone gel are among other treatments of acne. Most of these treatments are available over the counter without a prescription. The general rule is to start with a mild treatment such as benzoyl peroxide and move on to a stronger treatment like tretinoin if necessary. Epiduo gel is a combination of adapalene and benzoyl peroxide, and it can be an effective combination to treat more resistant acne. This is only available on prescription from a doctor. Acnetac is another prescription-only topical gel that can work well for acne, and it contains an antibiotic called clindamycin plus tretinoin. If topical treatments do not work, the next step is to try an oral antibiotic such as limicycline or doxycycline, which generally work very well. The last option is Accutane or isotretinoin, and this is reserved for very severe acne that does not respond to conventional treatments. It is only prescribed by a dermatologist. The other treatment options for acne are photodynamic therapy, comedone extractor to remove whiteheads and blackheads, or chemical peels. If standard over-the-counter treatments do not work, it is advisable to see a doctor or dermatologist in person for further assessment. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Images and animations in this video are only for illustrative purposes.